Welcome to Implementing Global Standards in Contract Management webinar by GS1 Canada. Today's presenters are Elise Tiessen, Senior Strategic Operations Analyst, Supply Chain Infrastructure and Analytics, BC Clinical and Support Services, and myself, Rob Bell, Director of Healthcare for GS1 Canada. The agenda for today's webinar includes an overview of GS1 and GS1 Canada, and an introduction to the new implementation guidelines by use case publication, followed by a Q&A session. Global Standards 1, commonly referred to as GS1, is a global not-for-profit organization with 111 member organizations serving 150 countries worldwide. We have over 13 million subscribers. GS1 Canada is a member organization of GS1 and collaborates with over 20,000 subscribers who agree on the use of standards to solve common challenges involving end-to-end supply chain standards from point of manufacturer through to patient electronic health records and beyond. We are best known for barcodes and are the only authorized provider of GS1 standards in Canada. In Canada, through our unique community management role, we collaborate with business leaders, sector boards, advisory councils, and industry working groups to develop standards, guidelines, and non-proprietary business solutions. Partnering with industry, we provide education and implementation support to subscribers of all sizes across multiple sectors. Within GS1 Canada's governance structure, we manage 5 sector boards, which includes the Healthcare Pharmacy Sector Board and the CareNet Healthcare Sector Board. GS1 Canada facilitates the Healthcare Provider Deployment Committee and the Healthcare Technical Standards Work Group, which focuses on advancing the implementation of global standards in healthcare through standards education, development of tools and resources. The Healthcare Provider GS1 Standards Implementation Guidelines by use case being presented today is a product of this collaboration. The Healthcare Provider Deployment Committee is facilitated by GS1 Canada and was formed in 2015 with the following mandate: to advance a roadmap and deployment strategy for the integration of GS1 standards and data integrity protocols, advancing a pan-Canadian initiative to achieve enhanced patient safety, improved health system quality, and overall system efficiencies in the Canadian healthcare sector. The committee is comprised of senior leaders from Canadian healthcare organizations consisting of hospitals, shared service organizations, and group purchasing organizations. The Healthcare Technical Standards Work Group mission is to create a forum for the Canadian healthcare medical device community to discuss GS1 standards implementation needs and to further develop and maintain the Canadian healthcare medical device technical implementation guidelines. This is to enable capturing national requirements and ensuring continued alignment with North American and global standards. We ask that you get involved in the standards development process today by emailing healthcare@gs1ca.org. I'd now like to ask Elise Tiessen to speak about BC Clinical Support Services plans for using global standards within the contract management business process. Over to you, Elise.
Thanks, Rob. If you could just go over to the next slide, please. So let me give you a little bit of an overview about who BCCSS is. So BCCSS is BC Clinical and Support Services, and we're a not-for-profit society that promotes health in the province by coordinating, managing, and providing clinical and support services to the BC healthcare system. Our organization is made up of 2 divisions, being Clinical and Support Services. Our clinical division includes BC's Agency for Pathology and Lab Medicine and the Provincial Blood Coordinating Office. Our Support Services division includes Financial and Employee Services, Supply Chain, and Technology Services. For this webinar, I'll be focused on the supply chain part of our Support Services division, as that is where our contract management takes place. Another thing to note is as of March this year, BCCSS was moved back under the Provincial Health Services Authority, and that amalgamation is still underway. Next slide, please. So let me tell you a little bit more about our history and how we got to where we are today. So prior to 2009, each of the health organizations in the province of BC did their own support services, such as supply chain. Then in 2009, a case was put forward and approved for a shared service organization that would combine the support services done by each of the individual health organizations into one organization called Shared Service Organization, or SSO. This was very successful in proving the case, and so in 2010, the SSO became Health Shared Services of BC, or HSSBC, as an agency under the Provincial Health Services Authority. Then, after 6 years of providing support services, the BC Ministry of Health decided that they would separate HSSBC from PHSA. HSSBC would then join the clinically oriented BC's Agency for Pathology and Lab Medicine and the Provincial Blood Coordinating Office to create a new standalone organization called BC Clinical and Support Services, or BCCSS. Just earlier this year in March, as I mentioned on the last slide, we had another change in BCCSS is currently being amalgamated into PHSA, the Provincial Health Services Authority, as per the Ministry of Health. We're looking forward to continuing our work in the years to come. So in the province of BC, we have a number of different member organizations, and these are the 7 health authorities. Each of these has their own clinical requirements that can make contracting a little bit complicated. Those organizations are Fraser Health Authority, Interior Health Authority, Northern Health Authority, Providence Healthcare, Provincial Health Services Authority, Vancouver Coastal Health Authority, and the Vancouver Island Health Authority. So let me tell you a little bit more about our current state for contract management, and then after that we'll take a look at what we're looking to do for the future. So after completing a competitive bid process, BCCSS awards a contract to the successful trading partner. We then request a complete list of the contracted items from the trading partner, including details such as product numbers, units of measures, descriptions, and prices. BCCSS then looks into each of the health organization ERP systems using the product numbers and other identifying information to find all of the applicable item records that fall under that contract. In many cases, the information in our different ERP systems for each of the health organizations may differ, and this causes a lot of extra work to identify the correct records have been located. It's very time-consuming for the people that conduct this work, and sometimes information or item records can be missed, as there isn't a universal code common to all of them. After this, BCCSS identifies if there are any new records that need to be created as a result of the contract, and those new items are set up in the systems with information that is manually sourced from the list received by the trading partner. From there, BCCSS then manually updates and creates any of the necessary item records in all of the applicable ERP systems with the relevant contract details such as the price, terms, and things like that. As you can probably tell, this process is very time-consuming and prone to error due to the multiple manual steps that require a person to distinguish item records and submit updates in a timely manner. So, with that in mind, let's take a look at what we're hoping to do with our contract management in our future. So to streamline the process and improve our data quality in a number of areas, including contract management, BCCSS is beginning to implement GS1 standards and use GS1 data. We have already taken some of the first steps in posting our GS1 data requirements on the GS1 Healthcare Navigator tool and are working towards using GLNs to identify our trading partners. In addition to this, we are also beginning to ask trading partners to share their item data with us through either the ECCNet or GDSN data pools, and also looking to receive information through EDI 832 catalog updates. We hope to start storing and using more GS1 identification numbers like GTINs so we can better identify our items. With that in mind, I'll talk a little bit more about some of the changes that we hope to see in our process going forward. So after awarding the contract to a successful trading partner, BCCSS envisions asking for an EDI 832 catalog from the trading partner with all of the contracted items and their pricing details. Then, using GTINs, BCCSS plans to then automatically match the new contracted items in the various ERP systems. Due to the GTIN being a unique identifier, manually searching for item records and hoping to find the right one would be greatly reduced, and so we would save a lot of time and effort in that area. If any of the contracted items were new and needed to be created in the system, BCCSS would then pull in the information from GS1 data sources such as ECCNet or the GDSN, so we could quickly and accurately create the new item records in our ERP systems. All of the other items would then be updated seamlessly with the contract details and pricing provided in an EDI 832 catalog, along with any other further information that we might need. Our true goal in our future state is to use the standardized unique identifiers like GLNs and GTINs to improve the process and, of course, the quality of our data. When we look at the new process, we see a number of benefits that could be realized through a full implementation of GS1 standards in our contract management process and beyond. First, through using standardized item data from ECCNet or the GDSN, BCCSS would be able to have more consistent and accurately described products, which would assist our clinicians in our member organizations in picking the right item to order. Second, by improving the quality of the item information in our health organization ERP systems, the downstream clinical systems would also benefit in improving their quality and accuracy. Third, BCCSS also anticipates that the amount of time spent to process item updates due to contract awards and implementations would be greatly reduced in both effort and duration. Manual identification of item records and the various problems that arrive with that manual work would be greatly reduced. The fourth point is one of the biggest points that would be a direct result of improving our data accuracy, and this would be an increase in payment efficiency. If the pricing for a contracted item is set up correctly from day one, then trading partner invoices would no longer be held up due to pricing discrepancies. Fifth, BCCSS would see an increase in cost savings by ensuring that all the contracted items on a particular contract award had the correct contract details and pricing. As I mentioned before, the current manual method leaves a lot of room for error for an item on a contract, and it might be missed and thus bought at an off-contract price. Being able to more easily identify our items using GTINs would reduce the possibility of us missing out on a contract price. The last and most important benefit to using GS1 standards in our contract management is enhancing patient safety. Ensuring that items are correctly described, priced, and available in our health organization systems ensures that the item needed for a patient is reliably and readily available for ordering. So I'll pass it back over to Rob, and he'll tell you a little bit more about the implementation guidelines.
Thank you, Elise. To help organizations like BCCSS implement GS1 standards, the Healthcare Provider Deployment Committee is working with community to develop implementation guidelines for common use cases. So why did we develop this guide? Well, across Canada, we're observing that healthcare providers are implementing GS1 standards for different business processes. It could be from the contracting business process, order management, the operating room management, and electronic health records management, just to name a few. Providers have asked for step-by-step implementation guidance by use case. This guide was developed in response to this request. The Healthcare Provider Deployment Committee and the Healthcare Technical Standards Working Group is committed to providing standards tools and resources to accelerate standards adoption in Canada. The Healthcare Provider Deployment Committee and the Healthcare Technical Standards Work Group have defined over 50 common use cases used in healthcare today. These use cases include both supply chain and clinical and post-patient care processes. We just heard from BC Clinical and Support Services about their plans to use GS1 standards within the contract management business process. To support implementation efforts for healthcare providers, we have developed implementation guidance that provides practical step-by-step information to support implementation based on generic business processes. So what is included in these guidelines? Within the guidelines, you'll find detailed definitions for each of the global standards that are used within that business or clinical process. An explanation for each use case is also provided. Business processes will vary by healthcare provider. Therefore, community took an approach to create a generic business process. Once the generic business process was documented, community then incorporated the applicable GS1 standards to show what standard is used and provided high-level implementation guidance. The guidelines include a list of benefits for implementing the various GS1 standards across multiple use cases. The document also includes information on technical considerations and recommendations when implementing GS1 standards within your organization. And finally, the guide provides additional links and resources to education and implementation resources to support your project. The Healthcare Provider GS1 Standards Implementation Guidelines by Use Case is available by the Deployment Committee at no cost. To obtain your copy, go to www.gs1ca.org, visit the Healthcare Sector homepage, select Standards, Implementation, and Guidance, and download the Implementation Guidelines by Use Case. Please note that additional use cases will be developed within these guidelines over time, so you'll want to check back periodically. The Healthcare Provider Deployment Committee wants you to stay informed, asking you to subscribe to GS1 Healthcare and Pharmacy Newsletter, your resource for GS1 Global Standards. It also asks that you access the GS1 Canada's Learning Zone to fully understand the benefits of implementing supply chain standards. If you are interested in joining the Healthcare Technical Standards Workgroup or the Healthcare Provider Deployment Committee, please contact us today at healthcare@gs1ca.org. A summary of today's webinar session. We know that healthcare providers are implementing GS1 standards for different business processes, and they're at different stages of implementation. Step-by-step implementation guidance has been developed for the contract management business process, and additional use cases will be added over time. The implementation guidance document is available from GS1 Canada at www.gs1ca.org. And finally, we would like to hear from you. Was this session helpful? Do you have any feedback on topics for future webinars? Please email your comments to healthcare@gs1ca.org. Once again, thank you for attending today's webinar, and have a great day.